I work at Eastern Health. I'm based at Box Hill, and I work as a senior consumer peer support worker. So I work at the adolescent inpatient unit and the adult inpatient unit up to the house. So my role is I work with one-on-one with people in the units, supporting them upon discharge. Quite often.
So they said, for the award, they said you were pivotal to the development of the new post-discharge support team there at Eastern Health. What does that look like, and what has it changed in the way that the service functions?
Well, to give a little bit of background,
yeah, please.
The post-discharge initiative was funded by the Department of Health and Human Services to put peer workers into inpatient units as a goal of when people are discharged from these units, that they have some support in the community afterwards, in the 28 days afterwards. And it hoped to reduce readmissions. So in building up this workforce, it meant, well, hiring a whole bunch of new people to work within Eastern Health that we hadn't had before. They're all permanent part-time roles, so it was something all new, big event, I suppose, for Eastern Health. And we really need to look at how with all this funding coming in and all these new peer workers we needed to cover across we've got 5 different inpatient units across Eastern Health, including child and youth, adult and aged. And we knew we wanted to have peer workers to support everyone across the age streams, but also for consumers and carers. So it was a pretty big undertaking to build this thing up, and we knew that we wanted to make it a very sustainable workforce. So not only were we going to have all these peer workers, we wanted to look at what supervision supports they'd have, who would they talk to. So we looked at having a manager for our consumer and carer workforce, having senior peer workers like myself come in to support the other peer workers and help them with supervision, and around that's a purely peer-to-peer support service for each other.
Because what had been the problem for many peer workers without that?
Well, it's got a feeling of not sure where they sit, not sure what their role is. They're often a bit siloed. They're not quite sure what their role is. Not feeling often supported because they don't know who to talk to, who they can go to. Do they talk to the nurses who's running the units? There was always a little bit uncertainty. It was very unclear as to who supported the peer workers. So it was knowing that this has been a problem in the past, that we had to really think about how do we support our peer workers. And how do we build a structure that supports the constantly expanding peer workforce that we're having at Eastern Health.
And can you measure success through that process yet?
Oh, definitely. I think it's the fact that it just keeps growing, and the feedback from our peer workers has just been phenomenal, that they're feeling supported, that there's always someone they know who they can talk to, that they can do their job, they know what their job is, and they feel confident to do their job. And we just hear that constantly, that they're
Great. Which is not actually what you normally get to hear from the peer workforce.
That's right, and a lot of them said, I haven't felt this way before.
Yeah. Sam, they said that you work as a testimonial space peer worker for the Upton House inpatient unit, which I think is also in Melbourne's East.
Yes.
What is a testimonial space? What happens in there?
So the testimonial space was a research project around reducing restrictive interventions. So it was a...
Can you just describe restrictive interventions first?
So a restrictive intervention is when someone's placed in restraints, mechanical restraints, or put in seclusion, so a seclusion room. It's never a pleasant thing, and we try to avoid it as much as possible. For when it does unfortunately happen, the idea of the testimonial space is to provide someone an opportunity to debrief in a way and express what that was like for them. Whether they wanted to talk about it, whether they wanted to draw, we had things like Lego blocks and Play-Doh. We had all different sensory things they could play with to really express what it was like for them, to really debrief a little bit more. It also gave them an opportunity to give feedback to the service, to either make a complaint, a formal complaint, to work on, if they haven't already had an advanced statement, or if they had an advanced statement, to update an advanced statement, or just to give feedback about how things could be improved, what some of the warning signs might have been, what could have been helped, what could have been a good prevention in the future for themselves or others.
What were some of the powerful things that you heard in there that you wish would influence practice?
I think a lot of it is just a lot of miscommunication. A lot of it happened actually in ED. And it was a lot of frustration going on in ED that led to this sort of knee-jerk reaction of putting people into restraints, and it sort of, I think just a lot of the powerful stuff was just that they didn't feel like they were being heard. And it was just simple things, and it was quite heartbreaking that...
Do many people have a testimonial space in the many services or facilities, or is that something that you've started up there?
So that was
It's an awards night.
It's a busy, lovely, lively night, isn't it? No, that was, as I said, it was a research project, so it was sort of a pilot project. So that was something that we tested out. We wanted to see how that would work, and offering that to as many people as possible.
And how are you measuring its impact?
So looking at the feedback resources and that, the successes, the failures, not everyone was up for it. Not everyone wanted to talk about their experience, and that's perfectly understandable. And a lot of people just caught them at the bad time. And
in general, with the work that you've been doing there, do you feel that you are having an impact on service delivery? And if so, can you describe sort of standout things where change has come about?
I suppose yes, part of my role is direct, I suppose, systemic work. So I sit on a lot of different committees, from things around safe wards and ECT and all that sort of stuff, and how we can improve this little simple things. Some of the projects I've been part of, yes, there has been a lot of direct improvements, and even the training work I've done, where I've literally been teaching psychiatrists what recovery is. Or at least it feels like I'm teaching it for the first time.
Yeah.
My journey has been with Eastern Health from the beginning, as I suppose a guest of their services, as a user of their services, and now someone who's behind the scenes helping to improve their services. And it's been, I suppose, a difficult sort of thing sometimes, because I'm around buildings I've been in before, and yes, psychiatric units still stand that I've been in. Their roles have changed. I've heard many worse experiences of other people during that time. I think I went through mostly unscathed in a sense. But then again, my memory of that time is a little hazy.
But did that experience itself, what role does that play in the work that you do now? Are you driven by that lived experience, or is it now a broader thing for you?
I think I definitely was driven by the lived experience. It was my lived experience of being a young person going through that system. I was 16 when I was admitted to the inpatient unit. My first roles at Eastern Health were in an inpatient unit, adolescent inpatient unit, telling young people that, yeah, I know it's shit scary and you think your life's over now, but it can get better. So I suppose, yes, it was definitely my lived experience of my recovery, of getting on, and being able to come back and say to people, yeah, it's tough right now. I've been there. It's going to get easier. It can get easier.
What do you think is the next major change that you would like to see, either at Eastern Health or more broadly in the mental health sector? What's the big urgent issue that needs to be addressed from a consumer point of view, which should be the main point of view?
It's a lot there, isn't there?
Yeah. Well, don't limit yourself.
And honestly, I'm drawing blanks right now.
That's all right. What you've said already is great.
I'm really wanting to see the continued growth of the peer workforce. I want to see it. It's done a great job, great work. I want to see consumer involvement expand, though, particularly in the youth sectors, the aged sectors, AOD sectors. There's a few things where it's sort of hasn't been the focus, and I think it's time to start focusing on those other areas. I mean, obviously, I'm a very big advocate for youth sort of mental health awareness and that, and it's always been my passion, and I feel it's somewhere that doesn't quite get the support it needs for young people's services and for consumers working in that area, and the carers too. Families need that support, and they're terrified, they're confused, they don't know what's going on with their loved ones, and they're very young, and so I think we need to we're doing great work, and we need to broaden.
Fantastic. Thank you very much, Sam, and congratulations.
Thank you very much.